I'm Venetia Rainey.
And I'm Arthur Scott Geddes.
And this is Battle Lines, Global Health Security. It's Wednesday, October 29th, 2025.
It's been just over 2 weeks since the ceasefire between Israel and Hamas came into effect in Gaza.
But while the full-blown war might be over, the World Health Organization warns that Gaza is experiencing a catastrophe that will last for generations.
Hospitals are barely functioning, and people are still in need of food, water, and shelter. Meanwhile, Israel continues to limit the flow of aid into the Strip.
So in today's episode, we're going to be asking, how do we make Gaza healthy again? How do you heal a city that's been under siege? And how do you rebuild a health system after such a long war?
The crisis is far from over and the needs are immense. Hunger and disease have not stopped and children's lives are still at risk. The demands on the health systems are huge, but significant parts of the system have been destroyed or badly degraded. The total cost for rebuilding Gaza's health system will be at least $7 billion.
That was Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, speaking a few days ago at a global health briefing in Geneva.
The challenge is enormous, that much is clear. So what needs to be done, and where do you start?
Well, we're joined now by someone who has plenty of experience with exactly that. Professor Paul Spiegel is the director of the Johns Hopkins Center for Humanitarian Health. He's led responses for the UN and international aid organizations in some of the world's worst emergencies: Afghanistan, the Democratic Republic of Congo, Ethiopia, Rwanda, South Sudan, Ukraine.
Welcome to Battle Lines, Professor Spiegel. What do you see as the most urgent public health priorities?
There are many, and I think it's very important that we actually prioritize because we can't do everything at once. So first and foremost will be safety, to ensure that there's a ceasefire compliance, that they have access guarantees, deconfliction with the Israeli Defense Forces, and that we address, at least in the corridors where we need to be able to go for health, for water, for shelter, that the unexploded ordinances are removed. The next big issue, so after safety and access corridors, are going to be life-saving services. And here we're talking sufficient quantity and quality of water, sanitation, proper shelter, food, power, and then fuel. And as we're seeing, this is insufficient what is being allowed in, but there's been times where there's been very little allowed and now a little bit more, but it's by far just not enough. And then the last two things would be a health services reset. We really need to focus on stabilizing trauma care and emergency care, ensuring primary care for women and children, and there's a large older population. So for non-communicable diseases, we also need to provide care, and that's going to have to be very focused with a lot of support from outside.
That's obviously a huge list of things to start tackling. Where do you begin? What are the biggest priorities?
What needs to be done, I believe, is if I had to choose two or three, it is safety. So making sure that healthcare workers and other aid workers are able to work in an unimpeded fashion where they'll be secure. Because without that, and there's been so many attacks on aid workers and healthcare workers and hospitals in particular. And then secondly, there needs to be a very strong focus on allowing as much water and food and shelter materials in. They'll just be simple transitional shelters for now to make sure that people have sufficient, you got to focus on the life saving. So it's going to be water, food, and shelter.
Can you give us a sense of how bad the damage is to Gaza's health system? I know something like 94% of hospitals have been damaged or destroyed.
I've never seen such destruction at this level and the comprehensiveness of destruction. So very few are standing and very few are functional. There are no fully functional hospitals, to my understanding, but we categorize them so they're partially functioning. There's such destruction that we do need to start from scratch. And there, I think it's going to be complex because there's a huge amount of rubble that is going to be removed, right? There's 62 million tons of rubble, and there's a plan for that. We can't do it all at once. So there's going to have to be, a decision of where to start. And I think it should likely be those existing primary healthcare centers and some of those key hospitals where the population is mostly concentrated, to start with that. And maybe just to add that we as the international community should not be making those decisions for Gazans. There's a very strong and competent workforce in Gaza. It's been decimated, but it still exists.
You mentioned the large amounts of debris and rubble in Gaza, tens of millions of tons. How is that complicating the relief effort?
Every humanitarian emergency is different and unique, but there are, as you were saying, some similarities. So if you may remember, in Mosul in Iraq, it was completely destroyed, and there was so much rubble there as well. It complicates things dramatically because there isn't enough equipment to be able to deal with all of this. Dealing with this rubble and the unexploded ordnance will take years, if not decades. And so it's again allowing the proper equipment in to be able to deal with this, but then getting agreement on how to go about removing all of this debris. And the debris is not just physical, but there are toxic aspects in terms of air, in terms of asbestos. So there are also a lot of health concerns, and it's going to be really a long-term issue that we're going to be dealing with. And therefore there needs to be, as I said, prioritization in terms of corridors, in terms of areas that need to be prioritized for the debris to be removed and for the air and other aspects to be cleared so that some of the essential services can occur.
Where do you start with trying to rebuild that system?
It's going to be complex, and even now I think because we need to be able to look at where the Gazans and the international community will be allowed to rebuild. But I think what will be most important is immediately is going to be still bringing in, you're going to need hospital tents, you're going to need self-contained, what we call emergency medical teams, which are there, some are already there, but you're going to need many more because the rebuilding will take more time. So first we need, the area-based care. So where the population is concentrated, we need to make sure that there's primary health care as well as hospital care. And then in the longer term, one doesn't want to just rebuild, but wants to, the classic phrase that I don't know if I love so much, but rebuild better, certainly rebuild with intention. And there, it's going to take some time. So I think we need to look at, as I said, where the population is, and we need to focus on what is more immediately needed and what will be longer term. And so trauma, rehabilitation, I think we need to really focus on preventive and primary care and not immediately start building back all of the hospitals, for example, but you need to build back some of the key hospitals and then use those emergency medical teams and those medical tents to supplement them. And then it's going to be at a systems level, right? I don't think we should focus just on the infrastructure, but the whole systems, which is the health workforce, the supply chain. It needs to be done in a very systematic manner, which I think can be done, is just as long as we're focused.
You've worked in conflict zones around the world. What makes Gaza different?
Number one is it's actually a relatively small area, as we're all familiar with, but incredibly dense, an incredibly dense population that has been destroyed. The infrastructure has been destroyed, but the people have been constantly displaced. And in many other situations, you have displacement, but actually people are able to leave the conflict zone, and therefore however horrific their situation is, they have some sort of safety and security. In Gaza, there just hasn't been that. It's one of those rare situations where no one was allowed to leave, a very, very small zone, or very few people were allowed to leave. And there was a constant bombardment. People would move. They were told there's a safe place, and then that safe place was bombed again. And so this relentless, over a 2-year war in constant conflict at such acute settings, I think has been quite rare.
What are some of the similarities, given you've worked in so many different conflict and post-conflict zones? What are some of the things that just never change, those challenges that just keep coming up?
Sadly, there are many, and I think one of them is well beyond sort of humanitarian, but it is the politics. And so what we see consistently is it's not necessarily, the funding is not necessarily needs-based. It's based on donors and their political desires. Number one. Number two is that more and more now we're seeing, and this was not the case decades ago, we're seeing deliberate attacks on humanitarian workers and deliberate attacks on hospitals. And so while it was extreme in Gaza, it's happening everywhere. And as we see, it's happening in Ukraine, it's happening in Sudan. And so there's been this change now where in the past the Red Cross or the Red Crescent was considered protection. Now it's considered a target. And that is making it very difficult for the humanitarian community to respond. There's also been deliberate attacks now on public health infrastructure, so on water, desalination plants, on in Ukraine and here as well in terms of fuel depots. And so there's that. There's the complete disruption of supply chain, and then there is the usual, let's say, starting off with trauma. And so you have a large amount of trauma cases that you need to deal with. But there's also what we call the indirect needs and the indirect deaths. So besides the direct deaths due to trauma, there is an increase of preventable deaths due to lack of medications, for non-communicable diseases such as cardiac, even things like renal dialysis. So that is rather consistent across the board.
Just on the politics point, how much more complicated does it make it in this already very heavily contested environment, as you say, that Israel alleges that Hamas uses hospitals to protect its terrorist infrastructure? We've seen evidence of this in some cases, not in all of the cases that Israel alleges, but clearly that's a factor at play here. That must make it incredibly complicated to try and protect and rebuild these hospitals.
It's very complex because international humanitarian law for places like hospitals, healthcare, schools, there is something called dual use. So they are protected, but when there are claims that they are being used not just for what they're intended to be, but also for military purposes, there is the possibility for authorities, for militaries to attack. And that makes it complex because it's very difficult to decide, particularly in the midst of war, what is the truth here. But that being said, there are some sort of safeguards. They get special protection compared to other settings. And so you can't just indiscriminately take out a hospital because there may be weapons there, or there may be tunnels underneath. So there's an aspect of proportionality to the dangers of the troops, and also there is distinction to clearly differentiate between those that are fighting and civilians. And I would say in each case here and in other situations, that's often being ignored, and so the lack of care in terms of attacking these facilities do not seem to be adhered to.
What about any learnings around things like polio, cholera, these sort of infectious diseases that we've heard mentioned multiple times in the context of Gaza? I'm wondering if you have learnings from other conflict zones that you've worked in about how to prevent the return of those in very insecure situations.
We need to really focus on water and sanitation early on, so that, immediately, because that some of these particularly diarrheal diseases as well as polio can be spread in that manner. And then we need to be able to ensure that vaccine preventable diseases, polio is one, but also measles, is that the vaccines are allowed to come in and very quickly. And so that needs to be a big priority. There was, as you know, a while back, a polio campaign that was quite successful, but that was mostly polio and not some of the other broader vaccines that need to be distributed. And then we need to also consider there is a cholera vaccine, an oral cholera vaccine that is used in many other settings. It's certainly something that can be considered here. One of the problems is that it is in high demand and there's insufficient quantity. And, we haven't talked about other settings, but that's also needed in Sudan and other places.
We're just over 2 weeks since the ceasefire came in. How much progress has been made?
I think very limited at this point. And one of the reasons is because from my understanding that not all of the hostages, the bodies of the hostages have been returned, and therefore the amount of assistance that is allowed to be going into Gaza. Israel is still limiting that. And they're also limiting which NGOs are able to go in. And therefore, there has been some more goods. There's even been medical goods being able to come in, but not even close to what is needed. And so it's still really limited. I still believe we're really limping along at this point. And it's not as if there's a ceasefire now and then within Gaza and the international community can now go in and just have access as if everything is now safe and secure. It's not like that whatsoever at this point.
And even if they could go in, and have unfettered access and get as much aid in as possible, there are still concerns that this is going to be a crisis that's going to last for multiple generations. Are you worried about things like stunting, this malnutrition crisis? What do you see happening, and how long do you see this crisis lasting?
Of course, the first part is making sure to try to stop the bleeding, stop the dying, and that's going to be the need for food and water and proper treatment of acute malnutrition. But the long-term effects of conflict, as you mentioned, in many ways intergenerational. There will be the stunting that you've mentioned. So kids, younger kids in particular, have had a lack of food for a long period of time. That is going to cause stunting, which is not just physical stunting, but also mental stunting. So their brains will not develop in the same way. We haven't even addressed at all the mental health and psychosocial issues, on both sides, of course, in Israel and in Gaza and in the West Bank. But the mental health issues will linger for decades, and there have been studies to show that this is intergenerational. And then the education, the lack of education for children. So that hasn't been over the last 2 years. The lack of education, the continuity has not been there as well, and therefore likely there'll be a lot of learning disabilities. There's a massive amount of people that have lost limbs, that have been severely injured. So the rehabilitation that is needed, but also the long-term effects of loss of limbs and loss of functioning of parts, body parts, and as well as mental health will also be, I think, generational.
What's it been like working on this issue on a personal level? I read your op-ed about feeling attacked because you're Jewish. And you're also talking about humanitarian needs in Gaza.
It's been complicated. It's been difficult, I must say. On a personal level, it's been very difficult because for me, I try to at least treat this like every conflict. It doesn't make a difference my background, nor even my thoughts politically, because as a humanitarian, the 4 humanitarian principles of humanity, impartiality, neutrality, and independence. So from my point of view, I'm just going in and trying to respond and help civilians, and it doesn't make a difference where they are and who they are. Also, as part of what I do, when I do respond or when I do work with different agencies, I come back and then as an academic as well, I'm also an operational academic in terms of I actually go on the ground often and then respond, and then I try to analyze what has happened, use evidence, and advocate. And so that is what has been happening here as well. When you see these attacks on healthcare facilities in such a disproportionate manner. And so speaking out has been hard. I feel I have an obligation to, and I would never not do that, because that's what I think is essential. But the ferociousness of sort of some of the attacks against me personally and have been, let's say, challenging. But it's also been a lesson for me as well to learn how to communicate this in a proper manner. By talking about civilians in Gaza doesn't mean that I don't care about the Israeli hostages or the mental health issues and the what has happened in Israel. So to try to get this right and to communicate in an effective manner is something I'm trying to learn and to improve upon. But it's turned out to be extremely difficult in this situation more than any other situation.
Just finally, if this ceasefire does continue to hold, what kind of time frame are we looking at to get Gaza's health system back on its feet?
Gaza and the West Bank, their health system was quite sophisticated, middle-income country, very, very, a very well-running health system. Therefore, it's going to take probably a decade or so. But that's why we need to prioritize and ensure, we look at the diseases that are most affected mortality, that are life-saving, address those immediately, and then try to phase in some of those other areas, such as rehabilitation. But it'll take a tremendously long time, and I think it'll be exacerbated by the amount of destruction, as well as the huge amount of unexploded ordnances, and the security and access. I think that will still be, there's going to be a lot that needs to be still worked out. I think the broad lines have been worked out, but clearly the details are lacking. And so that's going to affect how the international community and the Gazans themselves will be able to rebuild.
That was Professor Paul Spiegel from the Johns Hopkins Center for Humanitarian Health.
To find out about the situation on the ground, earlier today I spoke to Professor Nick Maynard, a consultant surgeon from the University Hospital Oxford, who's been travelling to Gaza for the last 15 years to teach and perform surgeries. Thank you very, very much for joining us on Battle Lines. What are the most prevalent medical conditions that you're seeing in Gaza?
I mean, there's of course been a huge amount of trauma, and that's been dominating and utilising the majority of the limited resources for 2 years now. And there are still many trauma victims every single day, indicating the ceasefire has been broken on a daily basis. Even when there is a full and proper, a complete ceasefire, there will still be many of the trauma victims needing further surgery for complications, for reconstruction, particularly the damaged limbs. So vast amounts of ongoing needs for the trauma victims to be operated on. There are, of course, all the chronic diseases which are not being treated properly in Gaza. There's all the cancer patients, many of the other diseases which haven't been adequately treated, heart disease, lung disease, kidney disease, you name it. There's a lot of infectious diseases which need to be treated properly. And of course, underlying all of these conditions is the profound malnutrition, which has, we know there's a famine status in northern Gaza and Gaza City. The malnutrition is extreme. And I last left Gaza a couple of months ago, and the amount of patients affected by the malnutrition are in their over 1 million, I mean, in their hundreds of thousands. All these chronic diseases I've talked about, their ability to recover from those and be treated will be affected by their malnourished status. So underpinning all of this is the profound malnutrition.
What are the conditions like inside Gaza's hospitals? Has there been any improvement since the ceasefire came in?
The volume of trauma coming in has reduced clearly, but it has not stopped. And remember, there are very few functioning hospitals in Gaza. Nasser Hospital is probably the only large hospital that's functioning remotely normally, and that's far from normal. They're all working with very, very limited resources, and although some resources have come in, it is still far too little. So they are still working in extremely challenging circumstances. It's marginally better, but there's a long way to go before they can function normally.
What's morale like among doctors and health workers in Gaza right now? Are they beginning to kind of see, to see results from the work they're doing?
They see results daily because they save lives. They're heroic in what they do. They know that many lives could be saved and aren't being saved because of the lack of resources. But they are still heroically saving many, many lives. They're passionate about saving their fellow Gazans. They're the most resilient, compassionate, heroic people I've ever come across. But they are almost completely broken. They're mentally, physically exhausted. They've all had close family or friends killed during this military assault. It's difficult to believe that there's anyone who hasn't sustained significant mental health trauma. I think that'll be right through the whole population. So they are profoundly inspirational, heroic people, but they are exhausted mentally and physically.
I wonder if you could just give me a few examples of some of the most inspiring things that they're doing, with the limited resources they have to try and alleviate this crisis.
Yeah, I mean, so many of the doctors I've worked with, some of them I've known for years anyway, but they're working 24 hours at a time. Sometimes they're starving. They're incredibly hungry. They're finishing their 24-hour shift. they're then going off to try and find food to take back to their family who've been in the tent, who've had no food themselves. One doctor I know passed out several times during operations. He had to sit down and he fainted on 2 occasions because he was so starved. And yet he then sort of shrug it off and come back to work. These people are heroic. I mean, every single doctor, nurse I can think of is behaving in the most inspirational way. One of the scrub nurses I know well was shot by a quadcopter, what the remote controlled drones the Israelis use. A quadcopter flown into Nasser Hospital, remotely controlled by the Israeli military, flown into Nasser Hospital, into the operating theatre complex where I used to work, and shot my friend in the chest. I mean, it beggars belief. He survived, and of course he was then arrested, imprisoned for a few weeks, came back, and as soon as he could, he was back to work. So these people, and they're not being paid, most of these people, so their heroism is profoundly inspirational.
If you were in charge of the rebuilding of Gaza's healthcare system, what would your first moves be?
The most important thing, in my view, is that the Gazan healthcare workers need to be in charge of this and driving this. They need to be in charge of the planning, not the Americans. The Gazans need to be in charge of this, with help from all of us from around the world. But those of us that can go and want to go to help need to have unlimited access. It will clearly cost a vast amount of money, and the whole world will have to contribute to that in order to provide the money to rebuild Gaza.
What about the evacuation flights? Are they having much of an impact on the scale of the crisis?
I mean, we welcome all medical evacuees that do come out. Of course we do. But the numbers requiring medical evacuation, the last figure I heard was well over 12,000, makes the 50 children that our country has made arrangements to get over. We welcome it, but of course it's a far, far too few, and of course far, far too late. We and many others have been pushing for Britain, other countries, to accept medical evacuees for 2 years, and the numbers that have come into this country is shamefully low. So, it is good that we're getting some, but we need to take far more. Other countries have done much better. We need to do much more than we are at the moment.
That was Professor Nick Maynard from Oxford University Hospital.
That's all from us this week. We'll be back again next Wednesday. Until then, goodbye.
Goodbye.